There are three main treatments for coronary artery disease or blockages of the coronary arteries. The first is medications. Those include aspirin, statin, beta blockers. Those medications slow down the progression of the disease but do not make the blockages go away. Next is stenting. Coronary angioplasty or stenting is done through wire and catheter access in the blood vessels, either through the wrist or through the groin. Coronary stenting works very well for patients that have one or two blockages in a focal area that is amenable to opening up with a stent. The third treatment is coronary artery bypass grafting, or CABG. And that's open heart surgery, and that is generating and creating bypasses around the blockages. There's three main arteries on the surface of the heart. The right coronary artery, which supplies blood to the right side of the heart. The left main, which divides into the LAD, or left anterior descending, also known as the widowmaker, and the circumflex artery, which goes around the lateral wall of the heart. So those three arteries supply blood flow to the heart and have various smaller branches that we look at doing bypasses for. When we're deciding which option is best for you, whether medical treatment alone, medical treatment with stenting, or medical treatment in combination with coronary artery bypass grafting, we base that decision based on your medical problems and the anatomy of the blockages that you have within your heart. What we have found is that patients with more than one blockage, with two or more blockages, especially with a blockage in the main artery on the front of the heart, the left anterior descending, those patients not only live longer, but have less future heart attacks and need for stents in the future when they undergo bypass surgery compared to stenting. Coronary artery bypass grafting is one of the most common cardiac operations performed. It's in order to treat coronary artery disease, which is blockages in the blood vessels on the heart. This is the cause of heart attacks, which is one of the most common causes of death in the U.S. And that's one of the treatments is CABG surgery. Coronary artery bypass grafting has been around for over 70 years. It was first described using veins out of the leg. Over the years, people have tried to use different types of material, including foreign material, graft material, and none of those were found to last as long as the native tissue within the body. Nearly every patient that undergoes bypass surgery receives a bypass with the artery that runs under the left breastbone, called the left internal mammary artery, attached to the main artery on the front of the heart, called the left anterior descending. Now, for other blockages in the heart, we make a decision about using vein or radial artery, or sometimes also using the artery that runs under the right side of the breastbone, called the right internal mammary artery. And that's open heart surgery, and that is generating and creating bypasses around the blockages. For the bypasses, we use either vein out of your leg, an artery that runs under your breastbone, or sometimes an artery out of your wrist. Coronary artery bypass grafting takes about 4 to 6 hours. The first hour or so of the procedure involves getting the patient off to sleep, placing appropriate monitoring lines, including an IV in the neck, as well as blood pressure monitoring in the wrist, and a Foley catheter into the bladder. Once the patient gets fully lined up, and we then position the patient and sterilely prep the chest for surgery. The standard incision for coronary artery bypass grafting is an incision about the length of the breastbone, right in the middle of your chest, from the top to the bottom of the breastbone. And this is the sternal bone is divided with a saw and then put back together with titanium wires at the end of the operation. The next hour or so is typically involved procuring and preparing the conduits, whether that's the internal mammary artery, the radial artery, or the vein out of the leg. And then the next 2 to 3 hours involves the heart-lung machine, stopping the heart, sewing the bypasses, and then restarting the heart and removing the bypass machine and closing up the patient's chest. And that is how standard coronary artery bypass grafting is performed. Now, at some institutions, including ours, for patients who are good candidates that only need one bypass to the main artery on the front of the heart, we do perform robotic-assisted, minimally invasive coronary bypass surgery, which involves using the robot in order to dissect the left internal mammary artery off of the left breastbone without having to open the chest, and then making a small incision between the ribs on the left side of the chest in order to perform the anastomosis without the use of the heart-lung machine. This is a procedure that we've been performing here for several years and have very good outcomes, but is not an option for every patient and depends on your anatomy and your disease process. So when we're performing robotic, minimally invasive coronary artery bypass grafting, we make 3 small incisions on the left chest, and then the surgeon sets at the control for the robot. We bring the robotic machine up onto the field and place the arms of the robot through the small incisions in your chest. The surgeon then controls the robot and is able to dissect and safely prepare the left internal mammary artery using the robot as an assistant to perform that portion of the procedure. After heart surgery, you'll wake up in the ICU. Most patients have the breathing tube removed the night of surgery and are out of bed and up to the chair first thing the morning after surgery. The first day after bypass surgery involves an early wake up to get up and out of bed with the assistance of your nurse. Additionally, you'll be up and walking the hallways by the midday, and many patients are able to leave the ICU the first day after heart surgery. Patients typically stay in the hospital about a week, a lot of times a little bit less, between 4 or 5 days, depending on your postoperative course and your other medical problems. A majority of patients are able to go home after they are discharged from the hospital. However, our physical therapists and occupational therapists, as well as our exercise specialists, will work with you every day and help make the decision about what's the safest option for you. Once you get home, we do want you up and moving around. However, it is very normal to have fatigue and need an afternoon cat nap for the first 4 to 6 weeks. But this will improve with time. Your body is running a marathon every day to recover from the heart surgery that you've had. The main limitation after heart surgery is no heavy lifting until the bone heals. This takes approximately 12 weeks. However, most patients, when they follow up in clinic around the 4-week mark, are not only feeling much better, the fatigue has passed, they are up and about, that we allow them to return to driving and most of their daily activities. The main limitation that remains is the heavy lifting restriction until the bone heals. After your follow-up visit, most folks begin cardiac rehab, which is typically an 8-week program where you go 2 or 3 times a week to an outpatient cardiac rehab close to your home and have a monitored exercise program to build your endurance with the security of knowing your heart is monitored and that you're safe as you escalate up on your activities. The risks of coronary artery bypass grafting are actually able to be calculated using the Society of Thoracic Surgeons risk calculator based on your specific risks what other medical problems you have, and your age and other information. Typical patients who undergo this procedure, a risk of mortality or a risk of dying from surgery or within the first 30 days is typically between 1 and 2%. I know we covered a lot of information today, and a lot of the things that I talked about are a little bit scary, and that's okay. Hopefully this is the only time you will ever have to have heart surgery, but this is what we do every day, and we're going to take really good care of you.